12:01, so I believe we are ready to begin. Good afternoon, everyone. Thank you so much for taking time, hopefully out of your lunch or whatever you might be doing in your day, to join us for another episode of the Equity Alliance Equity Series. I am joined by my partner in all things equity, Wafa El Khalifa from Destination Medical Center, where she serves as an equitable development manager, and I serve the City of Rochester as a diversity, equity, inclusion director. And today, as a reminder, for those of you who are new, the Equity Alliance is about collaborative equity in practice. So we have folks join us from across the country to either share best practices, share projects, ideas, hoping to implement them within our own community to ensure that we have equitable growth. Part of that includes this commitment that we are committing to co-creating a healthier Rochester, where everyone gets to participate equitably in the design of public policy. So our purpose and goals are to deliver equitable outcomes, all people at a time. Today, we are really excited to be joined by two folks from Destination Medical Center, Catherine Malberg, who serves as the Director of Public Infrastructure and Development Strategy, as well as Lauren Jensen, who serves as the Energy and Sustainability Manager. They will be sharing a presentation, some questions, so looking for your full participation as you can, referring to America's City for Health and talking about the DMC's development plan. So feel free to utilize the chat or raise your hand and mute yourself when it is time to ask questions or respond, provide reflections. With that, I will pass it on to Catherine and Lauren. Thank you for joining us and sharing your update.
Well, thank you so much for the welcome, and I'm really happy to be here. Let me just see if I can move my presentation into presentation mode. All right. Well, thank you so much for making the time to be with us here today. And I wanted to also take a moment to introduce some additional colleagues that are helping to work on this 10-year milestone kind of midpoint update to the DMC Development Plan. From Smith Group, we have Michael Johnson and Mashri Valentine. If you want to say hello, I think it would be great, so that the group can recognize you all, because you'll be in the community and might have a chance to meet in person.
Hi,
Thanks,
I'm
Catherine. Masha, go first. Yeah.
Sure. I'm Mashri Valentine. I work with Smith Group, and a part of the work that we do is making sure that we can connect with communities to help them build places for a better future. And so we're really excited about doing this work with you all, listening to your stories and getting into the details of how we can make Rochester that place that everyone wants to come and live. Michael?
Yeah, and I'm Michael Johnson. I do lead our urban design team at Smith Group, based in Michigan. So would love to just can't wait for this conversation, and excited to share kind of where we're at in the process. And so Catherine and Lauren and the team, thanks for inviting us.
So today, what we're really trying to do is make sure everyone understands kind of where we are in this update to the DMC Development Plan, what it is, why we're doing it, what we have learned from looking backwards and saying what happened during the first 10 years of the DMC initiative, kind of what we know about what's going on today, and then a little bit about what's coming in the future. And we're going to be inviting you all to participate in that upcoming annual meeting, where we're going to be talking in more depth about the future focus of the DMC initiative. So just a reminder, this is the kind of core definition of who we are at the DMC, and this aspirational vision to really become America's city for health and the world's premier destination for health and wellness. And the legislation, the enabling legislation, was voted into law in 2013 for the initiative to start in 2015 and span 20 years to go to 2035. And also baked into that was a process where every 5 years we're supposed to pause, reflect, look backwards, say, okay, what did we think was going to happen? What happened? Where are we now? What is the situation in the market? What is the situation in the community? What's going on? And reproject forward what we think might happen in the next 5 years as it pertains to where we should be investing in infrastructure in the DMC district. So we're at that second kind of milestone here, the second 5-year update to that 20-year trajectory. And that work happens in the same time frame as all of these other initiatives and planning efforts, and we really try our best to be a partner and understand and coordinate with all of these other processes and planning processes that are happening constantly as the community grows and evolves over time. So really our goals are not just to meet and exceed the state requirements, so we have to do this, but also we're at this moment in time where we can build off of this existing momentum. We can confirm strategic priorities. We can talk about what our commitment considerations are and start planning for a horizon that's even beyond 2035. And so that's where we are now, this kind of midpoint inflection point in our journey. So then looking more specifically through what it means when we say we try to work through an equity lens at the DMC, and really at the highest level, that's about inclusive access to Rochester's growing prosperity. So that's the lens that we're trying to use as we think through our work, both in sort of our programming and our policies and also our infrastructure investments. So these are on the left of the screen here, DMC's kind of what we call our very top line goals that are baked into the initiative from the beginning. I'll just run through those really quickly. So first off, we have to be strategically planning and integrated with all of the other state, county, and city planning exercises that are going on, so that we're not out of step or out of alignment with what the city's plans are for the downtown. We are also have a target of attracting at least $5.6 billion in private investment dollars, and that's what unlocks the public funds that have been allocated to the DMC. So if we don't certify and get that amount of private investment, then the public funding doesn't get unlocked. So that's the first of the really quantitative goals that we track. The second of the quantitative goals is this target of 30,000 new jobs by the end of the initiative. The fourth one is really an outcome of that investment in those jobs, and that's the net new tax revenue over a 35-year period, actually, that started in 2015, of getting somewhere around $8.5 billion in new net taxes. The bulk of that is expected to come from payroll taxes off of the new jobs. And then finally, the fifth goal, the one that I get most excited about, is how are we creating a world-class experience for everybody in the downtown? And so when we think about these 5 goals, again, at the sort of very highest level, framing that through the equity lens, who's participating in those planning exercises? Who's benefiting from these investments? Who gets to participate in those investments? Not just number of jobs, but what are the qualities of those jobs? Who has access to those jobs? Where is the growth happening? And then finally, how are we ensuring that this world-class experience is truly something that is accessible for all? So at this midpoint, we engaged a consulting team to look back and be a sort of objective third-party view on the data that emerged out of the first 10 years. And at the highest level, they measure us against those 5 goals. And we did have a couple of presentations in May that I know hopefully my colleagues can put the link in the chat. There are recordings of those full presentations if you want to really dig into the details behind each of these targets and hear the presentation in full. But at its highest level, these are the findings that came out of that look back. So I encourage you, if you're interested in learning more about that, we do have that documentation available. But for the purposes of today, I thought we might use this as an opportunity to dive deep in 2 of those categories. That's the jobs goal and the experience goal. And what you're going to be seeing today is a lot of the sort of top line data that's been collected around that job growth and some of the ways that we've started to think and look at experience within the DMC district. But at the same time, I recognize that a lot of this information might be of better use or value to you in disaggregated ways. Like if we could break it down and get a more qualitative look at some of these things, or understand how different communities are accessing different parts of this. And so what I'm hoping to do in this presentation today is if you're open to it, soliciting feedback in terms of what is potentially useful to you, either in your seat at whatever organization you might represent, or as an individual, as a resident or an employee in downtown Rochester. So it's an opportunity here to provide us with input and feedback as to what you might want to know more about that might help us better understand what could be valuable information to share back to you as we continue to evolve and grow this work. So I welcome you to do that. There'll be a couple moments in the presentation where we have a QR code you can scan with some specific questions, or you can also provide that feedback in the chat or via email afterwards for things that come to mind. And so with that, I think I'll move into this first deeper dive into the jobs section. So the numbers that we've seen is over the first, and it's actually not the full quite 10 years yet, because the way the national data sources work, there's a bit of a lag time in capturing the exact employment data for a geography as small and distinct as the DMC district, but we're at about 17,500 new jobs since 2015 in the DMC district. So within that bounded geography, about 1 square mile of downtown. And that's really right kind of at 50% of what the goals were for the 20-year life of the DMC. So that's really exciting news. So digging a little bit deeper, what we are also trying to understand is, what kinds of jobs those are, and what kind of diversification or other opportunities might be growing or available outside of healthcare roles. And so this is a graph that sort of shows the growth actually over the last couple of years for non-healthcare employment in the district, showing a positive trend, which is also, I think, a really exciting diversification opportunity. I think some of these jobs are probably still very closely related to the healthcare anchor that Mayo Clinic is, but are in different sectors. So different types of work might be growing as well. And then looking a little more closely at construction jobs, because we do very closely track construction, especially in all city and DMC funded public construction jobs. We have both workforce and so targeted job and targeted business goals and objectives. So what you're seeing here is solely within the construction field, looking at the overall Rochester jobs figures and Olmsted County figures, and there's been growth over the last decade of about 900 jobs. You can see that wages have grown. This is adjusted for inflation, so that's actual growth in wages in this sector as well. And then you can see on the lower corner there, the women and minority employment in those sectors, and seeing some growth there as well, which again, there have been very specific initiatives such as the Bloomberg Challenge targeting trying to see more growth in BIPOC female participation in the built environment trades. So this is some nice data to see. While the numbers are still kind of relatively small numbers, there is growth. And so this is some of the tools in this area as well that I'd like to highlight. A lot of this is done by partners and some in partnership that DMC is fortunate to participate in as well. But there's also been this growth in the capacity of things in Rochester that's been really exciting, and certainly contributing to this job growth that we're seeing. So the overall assessment was really that we're kind of above the Minnesota and Pierce Cities growth over that same time period, which is exciting. We're really right on target with what the DMC initiative was looking to do, but there's still more opportunities for more diversification and really leveraging Rochester's natural strengths and continuing to sort of do that. So this is the first. I'll pause here, and I don't know, Lauren, do you need to be sharing this from your screen if everyone that might want to get out your mobile device and scan this code and provide us some feedback here, I think that would be really great. You don't have to, obviously, but and also you can utilize the chat if that's more helpful for you. But I want to pause here to let people to provide some input, and also while we're doing that, if there are questions, we could answer some of those now and then move on with the experience section of the presentation.
I'll give it just a minute here, and then I can share my screen so we can see the thoughts that are coming in that people have or questions. You can scan that QR code, or I put the direct link in the chat.
Excuse me, I have a question. For the job slide and the growth in sectors outside of healthcare, do you have any more specific breakdowns like you have for the construction sector for the other areas of the workforce, or did you just kind of highlight health, not health, construction?
Right now, that's where we are.
Okay.
But again, like this is a moment for people to say, hey, it'd be really useful if you could do this. And then I can't promise we can find all of this data. Sometimes, it's just not something that's been collected, but I think it'd be really great if there are specific kind of areas that people want to know more about. We can at least dig in and sort of see if we can provide that back, because this is a nice moment to do that. So yeah, if you have specific ideas about what you'd like to see, we can at least see if we can track it down.
Cool, thank you.
Mm-hmm.
Just want to make sure folks are seeing some of the results on the shared screen.
Yes, we can see them.
You're cutting off a little bit, Lauren. Catherine, feel free to read some if you would like, in case people are unable to visually see the screen. Some of our participants listen to us versus watch us.
Great. Yeah, so I think we're getting some comments about, is there a way to segment out what would happen without DMC investments? Let's see, which I think is hard to do, but I think it's a question worth asking, and sort of, be able to sort of think about scenarios. Let's see, more disaggregated data and types of jobs and who is in those jobs, categories with different jobs and sectors, and maybe like the whole economy versus the DMC district. I know we do have some of that data, so we can start to visualize that some more too. So I think it's always helpful to understand downtown versus the broader community. So I think that's great. Let's see, where we can access afterwards. Yeah, we'll have a couple of different venues where I'll be able to share this presentation and some links, and then there'll be ongoing presentations as we continue to develop this work. Okay.
And Catherine, I would also note that after this presentation, we will share with the participants the slide deck. And so they will be able to reference the information there as well.
Yes, definitely. And then, some questions about education, and I'm excited that we'll be able to participate in the, and Wafa, correct me on the exact name, but Cradle to Careers Education Summit on October 29th, where we're going to go a little bit deeper, I think, on that connection between what we are seeing in the workforce trends that might lead us to some conclusions about what we might need to be doing in terms of readiness and the types of jobs that we are seeing more growth in, and sort of have that conversation, that dialogue with the educational providers. So I think that's something October 29th we're going to be working towards.
Absolutely. And we could definitely look into a part 2, maybe towards the end of the year or the beginning of 2026, where other team members from the DMC could share these economic projections and the focus areas, because part of our commitment is to keep all communities notified with the opportunities that they're happening in Rochester.
And maybe I'll add just a couple notes on the question regarding education. Our Equity in the Built Environment program did look at high school programming as well as college programming that could support those particular career pathways and jobs in the built environment. I also collaborate with the city of Rochester on green jobs initiatives. And so some of that kind of like home weatherization, energy auditing is things we're currently putting together as well. And then some of the data that we didn't get into in this particular presentation, but you'll see in the presentation, show UMR's student recruitment and how that has expanded. It used to just be within the Midwest, and now they are seeing students from all over the United States coming in for their classes here in Rochester.
So yes, thank you all for that that feedback, and we will continue. You can continue to add things because we'll get I think a record of it at the end of the meeting too, and we can respond to anything that we don't get to today. I'm gonna go back to sharing here. Next slide. Here we go. All right, so now I'm going to turn to the second category that I was going to go a little deeper into today, and that's about experience. And within the experience category, we try to capture some of the other private development that has happened, whether it's in hospitality, housing, retail, dining, entertainment, because all of those obviously contribute to the experience of the downtown as well. But first, I'll just ground everyone in these core user groups that were part of the initial framing and setup of the DMC district. So these are the sort of 5 major categories of people that we think about from the beginning with the DMC initiative. And so that's the people who are working in the downtown, the people who live in the community, and we think of that more broadly, not just people that are residents within the district, but people that are residents of the Rochester area. Patients, people who are coming primarily to Mayo Clinic. Companions, those who are traveling with patients, often have a set of needs that's distinct as well when we look at that experience metric. And then finally, other visitors that are coming maybe for non-Mayo Clinic patient visit related reasons that are also coming to the community. So looking at housing, this is the highest level. About more than double the number of people live in the DMC district than they did at the beginning of the DMC initiative, which we think is really exciting. It's great to see more people able to live in the downtown. The number of multifamily buildings has increased from 27 to 38. And interestingly, just had the opportunity to talk with some of the members of the Housing Coalition earlier this morning. And I think this is an area we're going to dig into more, but when looking at the district itself, housing costs have certainly increased, but wage growth has been outpacing that housing cost increase. So the housing cost burden, the percentage of people in the downtown that experience housing cost burden, which is defined as more than 30% of their income, it has decreased over the past decade. And I think that's primarily due to that wage growth. Places to eat. So we've tracked that 49 new restaurants have opened in the downtown. That is offset by 25 restaurant closures, but so net we're ahead by about 24 new dining establishments over the last decade. And so that's where we think the status is on the dining landscape. thinking about how we get around the walk and bike score. This is kind of divided out by different sub-districts and compared to the citywide walk score. So it's probably no surprise that the downtown core has enhanced walk and bikeability, but that doesn't mean there aren't still areas to improve. But it is, generally speaking, more walkable than the city overall. And then here, this is another way of thinking about livability in the downtown, the AARP Livability Index, which is really a great standard for evaluating communities on a number of different parameters. And when you compare Rochester scores very well in similar sized city comparisons. And when you compare Rochester to the US median, the largest sort of ways in which Rochester leads is in health, which is not probably too surprising, with a much higher than average patient satisfaction rate. Engagement, safety, and sort of neighborhood opportunities. So that is good. And again, also still leaves room for improvement, and a way of sort of thinking about what kind of metrics might be meaningful to people is something that I welcome more input about as well. At the same time, over the last 10 years, the DMC Development Plan called for 6 sub-districts with a signature public realm investment at the heart of each of those 6 sub-districts. So halfway through that initiative, and we've finished 3 of those 6 public realm projects, obviously in close partnership with the city and others. So those are the heart of the city investments, right in the center where healthcare meets hospitality. The Discovery Walk linear park, and then the investment in Soldiers Field, which was really exciting to see that come to life and see those visitor numbers rolling in for that new aquatic center. So again, looking at experience, we're doing well in terms of making progress around walkability and mobility enhancements. We're kind of right on target with the schedule of public realm investments and improvements. But I think there's still a lot of opportunity around bringing more visibility to sort of health-connected retail, dining, and entertainment opportunities. And that doesn't mean that they have to be health-centric, but sort of this idea that we do have this anchor in our downtown, as well as a growing student population, and how can we refine what the RD&E opportunities look like for today's downtown and for the future of downtown as well. So I'm going to pause here again and pose a similar sort of question to the audience here around in this experience sector, what information here was useful or helpful, or what might you want to see more of or dive a little deeper into, or something that we might be missing as we think through experience. So experience is a little less quantitative in some ways, but there are still quantitative measures you could use to talk about experience, but there are also qualitative measures to think about too. And so I'd be interested in, if people have ideas or thoughts or reflections in this area.
Catherine, while folks are doing this, I wanted to just elevate a question that showed up in the chat, maybe that you could respond to or think about while folks are answering this question. And it was about that AARP livability index. And the question is, says that Rochester ranks number 4. What is the criteria for how they measure livability, and how does equity show up in that criteria?
That is a good question that I probably am going to have to do a specific follow-up for, because it was our consulting team that did that analysis and knows the most about it. So I'm probably going to go to them and get back to this group on exactly what that framework looks like.
Thank you.
Mm-hmm.
And maybe just to help with those who want some context on that livability index, it's a widely used tool, and you can find it online. A lot of communities use it, but they're looking for those key performance measures that why people would look at housing, transportation, the neighborhood, the environment, health, and engagement. And taking those measures, we compared it against several different sources. So yes, there's lots of content that we can share in the future that will be helpful for contextualizing what Rochester means with this number 4.
Another question, Catherine, that just popped up here. On those 3 public realm projects that you showed up, curious about why they've been so successful. I think they're maybe asking about the type of engagement that was utilized to develop those spaces.
Yes. So yes, thank you for that question. So there was, and I don't think I think we try as much as we can for every project that comes forward to really be thoughtful about the unique characteristics of a project and ensuring that we're sort of building upon what we've learned from the last project as well. But we have found the co-design methodology to be extremely helpful in sort of developing both a vision and goals for what success might look like in public realm investments. And so that was certainly the Discovery Walk co-design process and the sort of community engaged public art components of that project were really, really significant contributors to the success of the overall project. And I know that we probably have others on this call, including from our team, that were very closely involved in those projects. So I would say the co-design methodology has been really, really helpful in aligning community visions, goals, and with the design process and the implementation process of those projects. We also have a business forward strategy that is really about understanding the impacts of these projects on everybody who is very physically adjacent to those projects. And developing tools and methods to ensure that adjacent properties and people are thriving even in a construction environment, which can of course be challenging. And then when it comes to Soldiers Field, that was a little bit of a different process where the DMC really committed to being a supporter of the community and city vision for what the renovation was going to look like at that project. So I don't know, I think we have some of my colleagues are on as well that were very closely involved in that, if anyone else wants to chime in on the public realm investments.
Some of the public realm investments that we've been looking at span across those different plans. And so looking at the ways that we're seeing the work in both the vision for UMR and the work that's being done for the recreation and public health helps to tie in what are some of the goals and values of what does it mean to be healthy in DMC and in Rochester as a whole. Michael, I don't know if you had any additional thoughts and comments from what we were looking at from our analysis across these plans.
I think that's a great start, and would defer to some of the other team from DMC on some of the stuff that they looked at previously too, on some of the work that's already been done.
And
Yeah, we are.
Catherine, I was gonna just remind you to go ahead and read a few of those responses as well for those who are listening to us.
Yes, definitely. Yeah. And I would say that we're also trying to pull out some threads of, there are certain reoccurring themes that occur when you're talking about a downtown and a public realm, and, and then there are certain things that are unique to every project. And so we're trying to both sort of incorporate what we learn from each of them and build on that, and also be sure that we are going into it aware of the unique characteristics of each of these projects. So I'll turn a little bit to some of the comments. Pedestrian traffic count in the downtowns, especially in the evenings. I think that's something we're working with some big data sources that the city has access to, like Placer AI, where we're hoping to get a little more intelligence around what that foot traffic looks like at different times of the week and different times of day. So I think that's something, yeah, we're kind of digging into. And then like the types of people and sort of, again, disaggregating the experiences of different groups like BIPOC patients or employees, or people that have disabilities and things like that. I think that's great feedback too. I think as much as there's some of these data sets that we're going to have to take as granted, but the ones that are a little more bespoke and specific to the local community, I think we'll have more opportunity to like layer in additional data on that side. And then some recommendations about the Mayor's International Relations Committee and an intercultural perspective. I like that. And these are all great comments. Accessibility. And so, I think a good thing about new construction housing is it's a lot more, with current codes and accessibility. The new construction is generally much more accessible from people with disabilities or that are using wheelchair or other mobility devices versus the older housing stock, which is sometimes challenging to retrofit. We also are looking, there's a framework I mentioned to the Housing Coalition this morning called 880 Cities, which is talks about how if you can design a city that works for an 8-year-old or an 80-year-old, it's probably going to work pretty well for a broader swath of society and people that might have mobility challenges. And that's something we're looking at more closely as well. Yes, and then, all multifamily, Lauren was noting that all multifamily projects have a requirement with new construction in terms of the percentage of accessible units that need to be included. And I believe the vast majority have to be adaptable, and then they have to provide a certain number right up front that are immediately accessible. All right, so let me go back to sharing. And again, please continue to provide feedback as we move to the next section here. So now kind of that was a little bit of like looking back, what has been happening, trying to gather data to understand where we have gone in the last 10 years, and now kind of turning towards, looking at today and in the future. So as I've mentioned, this is a continuum. It's a moment to pause, reflect, refine, and look forward and check that the sort of vision and values of the community are seen in our work. And one place where we are able to build upon those visions and values from the community is all of these other public processes that have either happened relatively recently or are happening concurrently with what we're doing right now. And you see a selection of those here. There's a new historic district and work being done around that. There's the Mayor's Vision 2050 plan. There's been a housing analysis at a regional level. There's the city's comprehensive plan. And a lot of these efforts have their own engagement processes and opportunities for community to participate and see themselves hopefully in these plans. And our team is really looking to, learn from all of these and build upon them. And so one analysis that they've been doing is pulling out the common themes that are kind of recurring across many of these community planning processes, across some of these co-design initiatives that have happened. And you can see some of the highlights here. They've sort of grouped them into these macro categories, if you might want to call them that. And then within that, sort of calling out some of the themes that they're hearing as they review all of these planning initiatives to date. So I'll pause for a moment there because I don't want to read it necessarily all, but there's themes around economic development and innovation, public spaces, transportation connectivity, housing, well-being, and climate resiliency.
Yeah, a few things to note, Catherine, for those that are seeing this. These are your voices that you're hearing for over the past several years. These are plans that are crafted from your input. And what's helpful is to see is that it is a consistent voice we're seeing in inclusivity. A lot of these things may have a top header of a topic theme like economic development, but how can businesses be inclusive in that manner? And how can all be supported and developed and thought of when it comes to housing and well-being, and how do we take care of the planet that we're living on and the space that we inhabit together. So community is well baked into all of these things, and how do we connect with one another?
Yes, thanks so much for that, Mashri. So now turning a little to what's next, what's coming next. So again, this is kind of taking what in 2015 was a core part of the DMC initiative and its identity to be the world's premier destination center for health and wellness, attracting people, investments, and jobs to America's City for Health. And in the first 5-year update, that was things felt like we're just getting everything off the ground, the cranes are in the air, things are happening, and then COVID gets thrown in there. So it was there was a lot of focus on what the COVID impacts might look like, and sort of seeing if the model itself was working, which was great, it was working, and the priority themes were really still around Heart of the City, Discovery Square, and that BRT corridor as the primary focus. So now here we are another 5 years later, and it's the second 5-year update. And really what we are headed towards is how do we transform and evolve and move this kind of tagline that we've had around America's City for Health and ensure that we're really utilizing that as a competitive strategy to sort of drive our work forward. And we're grouping that into sort of 3 main ways of thinking about this. One is health innovation as an economic engine. So leveraging the unique scale and the adjacency to Mayo Clinic and really lean in on this health tech as a way of driving innovation and economic growth, and really building this entrepreneurial ecosystem that is already in Rochester today, and how do we continue to foster and grow that into the future. Then the next one here on the slide is health in the built environment. So this is something that we have obviously been thinking of, and it's an opportunity, I think, to take it even deeper. How do we ensure that we're really centering physical and mental well-being in our infrastructure investments? What does it mean to really prioritize health and sort of build on this initial sustainability objectives that have been a part of the project from the beginning, and really expand that into a more holistic approach that centers health in all of our kind of physical investments that we're making. And then finally, health excellence as an attractor. So recognizing that, Mayo Clinic is obviously, it's a really unique to have the world's #1 hospital right in the center of your downtown. And there are special opportunities that come out of that. And also there's also other attractors that are really growing. UMR's growth, is, as Lauren, I think, mentioned earlier, they're bringing more and more people into the community as they're seeing that growth in the health related educational space. And so, that's an anchor that's becoming an anchor. Mayo Clinic is kind of generating these other anchors that are a constellation of them are growing in the downtown. So that's health excellence as an attractor, and really looking for those opportunities that are only in Rochester, only because of the intersection of these 3 things. We have this opportunity to do something really special with our infrastructure investments headed forward. So now a little bit more about the sort of pragmatics of what we're going to continue to be doing as we develop this kind of honed focus for the next 5 years. We've been doing some stakeholder focus groups, and these are the 8 different category types that are in the original legislation that you see here: commercial, research and technology, learning environments, hospitality and convention, sports and recreation, livable communities, that's where a lot of the housing comes in, retail, dining, entertainment, health and wellness, and then transportation. How are we connecting and getting around? And so we're continuing to have conversations with people around that, understanding what our partners and other strategic alliances have in mind as they move forward in the future and where we might have some intersections. So we also have a really exciting upcoming opportunity next week on Thursday, is the DMC's annual meeting. That's a free event open to everyone. I think hopefully one of my colleagues can put a link in the chat to register for that. And this year, the topic is really going to be a deep dive into those 3 drivers that I just reviewed there, and sort of have some presentations around that, some discussion around that, so that we can help have that dialogue with the community about what we mean when we're kind of honing our work in around those 3 health-centered drivers. There's also an opportunity to participate in an online survey, and I know that that is a link that I believe the equity series did not have a meeting in August, but I believe Wafa and Chow were able to share a survey link, and I wanted to let you all know that this is what the response rate has looked like so far, with over 250 responses. I don't know, Mashri, do you want to share any more on this? I think we're sharing it to reflect back, like, who's responded so far, and encourage you, if you haven't, or your community hasn't responded yet, that I think there's still an opportunity.
Yeah, one of the things that we look at when we're doing these surveys is who are we hearing from, and does it reflect the community that we're engaging? And so based on the numbers for Rochester, talking to the DMC staff and those that are within the city, these numbers of people that have responded so far don't reflect the culture and the fabric of our city. And so we want to be able to hear from more people. So the September 18th opportunity is a way that we can try to garner more responses, more equitable representation of the people that live in Rochester and how they see this future forward, moving for how you can embrace and to be a part and reflect it in the DMC. So we look forward to engaging with you more and finding out how we can move forward together.
So that's what I have for today. And hopefully we've left a few minutes here for any additional follow-up questions or conversation that we wanted to have. Thanks so much.
Thank you so much, Lauren and Catherine, for preparing that presentation and sharing it with us. And I appreciate everybody who's participated. You've been really active in the chat and in the other tool that was utilized in Slido. But this is an opportunity for you all to ask questions. So you can unmute yourself and ask a question or share a reflection. You could also put something in the chat if that's an easier way. I'm happy to read some of those questions and reflections. And while you're thinking about that, I do want to kind of highlight Carrie's point here. She did say, I would advocate for including the word accessibility when talking about housing in other spaces. Affordability and being inclusive is always emphasized, but accessibility is important to be called out so that it is always considered and is the forefront of existing and newly built environments. So wanted to read that out loud for everybody to hear that, but I'm looking forward to kind of hearing from you as well.
Hi, can you hear me? This is Al. Yeah.
Yes, we can.
I put on a chat too, and I've been involved with the Americans for Health in this old format when the cabin at DMC used to buy that, drive that. And we've been meeting like 2 or 3 years, and then it's just sort of dissolve a little bit and get into different mode and turn into a co-designing effort. So I'm just wondering, in fact, I would suggest that we want to somehow re-examine, review the history, some of the work, that experience that we had, and not to, waste all the effort that's been put in there, so that we can, we don't have to start, from the ground up. And I'd be happy to share whatever I have gathered. As you probably know, I'm in the habit of, preserving information. So if you come to my website, you'll see all the information that I have preserved. And the whole idea really is to, not to work in silo mode. Let's make sure that we do go a little deeper in terms of connecting with efforts that are going on already, utilizing our expanded work group. In particular, I mentioned the fact that I'm also involved with community mobilization, a group of people that try to bring in the voices of minority voices. So if you can utilize our platform, we can distribute it to the minority groups so that we have a way to showcase the fact that the minority voices can really contribute to a larger conversation, including the mayor's effort about building a more global city to drive global health. So we have a pretty ambitious vision, and I'm glad to see that there is this renewed effort to really bring forward the picture of America's City of Health being the vision for Rochester. And I'm really excited about what you're doing, and hopefully we can all contribute to it, I guess.
Yeah. Thank you, Al.
Yes, thank you so much.
Yeah. I don't see additional questions in the chat. Is there anyone else who would like to unmute and share a reflection or a question for the DMC group? Because if not, I do have a question that came to me specifically about the update to those drivers. You know, it was like health as this, that, and the other. Wondering
Ciao.
how.
There was actually a comment in the chat
Okay.
from Guthrie. Tough not to see American Indian Alaska Native within the data.
Oh, yes.
Yeah.
I'm sorry that I missed that. Yes.
Yeah,
So
I really forgot to send it to you. Just kidding.
okay. Thank you. Thank you for highlighting that.
Yeah,
So
it would
maybe
be.
adding that to it.
Well, yes. And so what we showcased is who we've heard from. And so unfortunately, we haven't had anyone self-identify as, well, I should say in the online surveys for some of our in-person engagement, we had a few people that did self-identify, but for the online survey, no one self-identified yet. So when we look at the comprehensive data later on in the work that we're doing, we can show that as a part of the work.
Thank you, Mashri. The question that was shared just to me specifically was about those update to those 3 drivers. And, you know, I think it was economic engine, built environment, and attractor, wanting to know what role equity plays in that update of those 3 drivers.
Great. Yes, thanks for that question. So those 3 drivers are, again, the broad, and I like the way you summarize them, Chow, right? Those are the broad ways in which we're sort of thinking about how we're centering health, to build on your comments, Al, like kind of refreshing that centering America's City for Health. And these are the sort of 3 subcategories, as you will. And we are, so I think the next step with each of those is that we're going to be, and we're doing a lot of, work within our team to understand what are ways in which we could measure ourselves in each of these things, or use it as an evaluation tool, a way of prioritizing competing demands for, limited projects and all of that. So that's the next step, is to develop those, and below each of those kind of categories of thinking about what contributes to each of those 3 main categories, there are KPIs that will also need to be developed. And I think what we're trying to do for each of the pillars as well is to look at them through a sustainability lens and an equity lens, as we're both doing that process of like, okay, what are we going to measure and what are we going to look at, and what are the KPIs that feed up to that. And so the hope is that we will have a sustainability and equity lens over each of those drivers that will find its way into the way in which we're sort of trying to measure things, I think, as well as consider where opportunities lie if we really sort of center an equity lens when we're thinking about, let's say, how we're going to build the workforce that's needed for these new types of jobs that we project are going to be growing in the future. And so we've had some of that pretty specifically for the construction work, because we are primarily an infrastructure funding organization, right? So that was a natural fit. But I think as we sort of move to have more programming about business recruitment and entrepreneurial ecosystem and job growth, I think there's an opportunity in that area to start thinking about, are there specific ways of setting up programming or goals in those other sectors outside of construction, for example.
Yeah, thank you. Just a reflection on my end before we start to wind down, and maybe it's a reflection/question. Notice in the survey how big of a disparity there is between the respondents of the survey and the communities that live here. But also notice that you had the slide that talked about the focus groups that you have so far. I think it was 30 plus focus groups. And I think it's more a reflection. A question is, do we have better representation in those focus groups? Or what is the intention in making those particular focus groups a little more diverse so that maybe we're capturing what we're missing in the survey? So I don't know if I'm asking a question or just reflecting, but feel free to respond.
Yeah, no, I think that's a really good point. I think there's still work to be done there as well. I think in the so the stakeholder focus groups have been sort of initially driven by some of the partners that we have worked with, since the beginning of the initiative, but I think there's room there to expand, kind of who is in those groups, and Wafa has been a part of, kind of our active conversation around what are some ways where we could maybe do that, and do that better, whether it's, and this might lead towards a co-design process of its own, right? To sort of say, if we're not getting to the point where we can get representation in our own internal planning processes, then maybe we need to look at what those barriers are.
Yep. Last question. Lisa asks here, based on the current survey, what are the ways you plan to reach target more people that represent the city of Rochester? So you somewhat touched on it, but I wanted to highlight that question from her.
Yeah. And I think that's why, I think I'm trying to have more conversations to surface what's happening while we're still doing the work versus waiting until later in the process where a lot of these, this work and data collection is already done. And, there's not as much room for noticing who hasn't had the chance to sort of participate and understand where we are when we're still in the middle of the work. So I think that's something we're trying to do, and trying to, now that we have sort of a framework, to get in front of as many audiences as we can in the meantime. So welcome if there are groups that you think would benefit hearing from us and sort of understanding where our thinking is at this moment in time. I think that's a possibility.
All right, thank you so much, Catherine. And I think we all have a little bit of homework, which is obviously to reflect on what was shared today. If you have any additional information and you still have your Slido open, feel free to do that. Otherwise, you can email whether it's Wafa or myself, and we'll be sure to share that information with everybody else. But then the second portion is to ensure that communities that you're connected to respond to that survey or participate in any future kind of focus groups that come up. But just wanted to highlight a couple of things going on in our community as we wrap up today. Again, we survive and thrive because we participate, right? And we share information with others. So really happy that this is happening. It is led by one of our nonprofit organizations. They are doing a survey that closes October 6th that is very specific to folks who are employed and paid by nonprofit organizations. Most of us in this group right now are part of that. So if you would like to participate in that, I'm leaving it up just for a moment so that you can scan that code. Otherwise, you can reach out to the Rochester area. Wafa, help me here. Why am I drawing a blank on which organization is doing?
The Rochester Area Foundation?
Thank you. Rochester Area Foundation.
Okay.
Sometimes that happens. Yes, that is the one that is leading the survey. So please feel free to either scan that or reach out to them if you have any questions. And thank you for letting me know that that link is disconnected. I will let them know and share that. The other thing that I would like to share is very soon upcoming on the 20th is Latino Fest. We're always happy to celebrate and share experiences with all of our cultural groups, residents within our community. As Wafa and I always say, our brothers and sisters, right, in our community. So if you can, this is a family-friendly event. Bring everyone. I go every year and have a wonderful time, both learning, sharing resources, but also just being in community. For the first time this year, they will also have a gala the night before on the 19th. So This is a paid event, so if you are interested, please go onto the ACLA website and purchase a ticket. But with that, we want to really thank you for joining us today. Our next episode is going to be on October 8th of 2025 at noon. Everything that was shared today will also be included on the DMC YouTube page for viewing at a different time. Have a great day and appreciate you joining us today.
Thanks so much.
Thank you.
Thanks all.